Katherine Weaver is my guest on the podcast today. Katherine is a passionate RN, mentor, and educator who's all about empowering the nursing community. When Katherine graduated from nursing school back in 2016, she realized that new nurses were missing out on solid mentoring. So she created a community where nurses and nursing students could flourish and feel valued. In 2019, she started her own YouTube channel, and her aim is to build the kind of supportive environment that new nurses need.
iHire connects you to industry-specific jobs in over 57 talent communities. Find your niche today on iHire.
So, Katherine, welcome to the podcast. It's so good to have you.
Thank you. I'm excited for this.
So, Katherine, what made you decide to become a nurse, and how did you get started in this career?
Yes, so I come from a family of nurses. So it kind of was just the natural trek for my life. It almost felt like my mom is a nurse, and so is her identical twin sister. So I grew up around the table. It was always talking about nursing, and that's just kind of what I knew. So there was never really any question in my mind besides when I was in 8th grade, when I wanted to be a dolphin trainer, that I was going to be a nurse one day. I think that was the only other career I ever saw myself going into, was being a dolphin trainer. But then my mom said, you need to find something a little bit more realistic. So I was like, oh, well, nursing, of course.
Yeah.
Why would I not want to be a nurse?
Right.
So that was, it was just natural to go into nursing. And my mom, it was so easy to get into nursing school with her help because she already did it. So,
Right. So, as a healthcare professional, what are some of the biggest challenges that you face every day?
I think that's different as your career goes on. When I first started nursing, it definitely was my confidence. I think every brand new nurse lacks confidence, which again, you kind of should, because a lot of nursing is on the job training in that first year. You don't know what you don't know until you learn.
Right.
And most of nursing is all hands-on. And that's how a lot of nurses do learn, is a lot of hands-on. You can see what the books say, but that's not actually what always happens in the real world. So I think confidence in the beginning of my nursing career, that was the biggest challenge. But most recently, which I have seen this progress as I've watched healthcare progress, is watching nursing become more customer service focused
Oh, yes.
rather than nursing focused. And that's been really hard because you learn nursing in school, and then you get to the hospital or to the real world, and it's all about the Press Ganey scores. It's all about, is the hospital going to get funding because are your scores high enough? Is the food hot enough for your patients? Are you bringing them enough coffee in the morning? Do they like the food? That has nothing to do with nurses.
Right.
Has nothing to do with my job. If the food is hot, but that comes back on the nurses, it seems like. So just watching nursing become more customer service focused has been really difficult, because you're never going to make everyone happy. And I think also with not being able to give answers to every situation, especially in the world we live in now, that you have your phone at your hand, so you can Google something and get the answer to something. But the human body is much more complex, and there's a lot that we still don't know about it. So when you tell someone, I'm sorry, I don't know why this happened, just instances like that can make it very difficult to take care of patients and very difficult to make them happy. And nurses are the ones at the bedside. So then as a charge nurse, I charge some, or I was charging sometimes, or doing bedside sometimes. You have to deal with those complaints, honestly, but a lot of it is out of your hands, and you can't do anything about that situation,
Right.
or what's going on. So that's definitely been the hardest or the biggest challenge in the last few years that I've faced.
And you have to be careful with what you say, because I know that patients and their families will ask you questions, and it's not that you couldn't answer them. It's just that you need to loop somebody else in to be able to answer that
Yes.
question and give like the
Mhm.
right answer for them.
Exactly. I can give you the sometimes, depending what the question is, I can give you the basic information, but I can't go into the deep information because that's not what I've learned. That's not what I went to school
Right.
for. And that has been complicating. Yes, for sure.
Well, so that explains a lot. I remember the first time that I was in a hospital room and the nurse came in and she did the vitals and did all the things that she was supposed to do. And then before she walked out the door, she said, "Can I get any of you anything?" And I was just
Mhm.
shocked at that because I didn't think that it was really their job to get people in the room stuff that they wanted. So, but it
Yes.
and now I
Mhm.
notice that every time a nurse walks out, it's like, can I do anything for anybody? And it's very appreciated. I'm sure if you've got a
Mhm.
sick loved one in the hospital, but I was really surprised at that.
And it's not always a bad thing, I would say, because you're there to holistically take care of your patient.
Right.
But some of the things, like, for example, the kitchens these past few years, like the pantries, were closed down to any patient from going in just because of everything going on. So they closed down the pantries, but now they're reopened. But patients are so used to nurses going to get them a drink or getting them a Coke, stuff like that, that they're like, "Oh, can you get me a Coke?" And then you got to go down to the pantry, get the patient a Coke, rather than telling your patient, "Oh, you can go to the pantry. That would be great. It would be great if you got up and walked in the hallway."
Right.
But patients aren't used to that anymore, so it's seen as rude if the nurse doesn't do it now.
Yeah, I see.
Mhm.
Well, that's one of the things that changed with COVID. What are some of the other things that you saw change over the last few years?
Over the last few years, it's been the lack of education from healthcare professionals to the patients and patient rights. I think maybe when I first started nursing school, maybe because this was so hard pressed in nursing school, was educate, 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 educate your patient about everything. They have the right to refuse, they have the right to accept, but they have the right to know the benefits or the risks of something. I don't see that happening anymore. It's a lot more fast paced. It's let's kind of get this clockwork going. Here's what I'm prescribing you, and this is what I'm prescribing you. And that's that.
Mhm.
There's not a lot of conversation going on between it. But then when the doctor walks out of the room, they ask the nurse, but I wasn't there also to know
Right.
exactly why they're prescribing something. So I don't fully know what to say. I can say what the medication's for, but I don't always know specifically why they prescribe that medication because medications have so many secondary uses
Right.
or tertiary uses. So I've seen that change over the years. Some doctors or nurses are much better with that than others. But I think that's an area where healthcare is failing, our America, is the lack of education behind things.
Right. And then on the other side of it, you probably have people that are Googling everything and
Yeah.
then
Mhm.
presenting that to you and wanting you to sort out what is true in their case and what is not.
Exactly. And there's so much information out there and so much research that as healthcare professionals, you try to keep up with it, but it's hard to because there's constantly information coming out about if something's good or if something's bad, but something is not always good for every patient and something's not always bad for every patient because the human body is so complex, everybody's body is so different. So that definitely poses some hardship for sure to healthcare workers.
Give me some context. What part of the hospital do you work in?
So I have worked in four different areas or three different areas of the hospital. When I first started nursing, I started off in general medical nursing. So you had withdrawal patients, hospice patients, your typical average adult, if you come in with something, you're probably coming to my floor.
Mm-hmm.
If you get your gallbladder out, some stuff like that. Just very small, little tiny surgeries, or if your appendix ruptures, stuff like that. And then after about 3.5 years, I went into ER nursing. And I was in the ER, worked in the 10th busiest ER in the
Oh,
nation,
really?
up in Pennsylvania. So, Reading Hospital, and that's actually where I went to nursing school. So, I worked there for about a year and a half until my husband and I moved here to Atlanta. Once we came down here to Atlanta, I was burnt out from bedside. So, I went into an infusion center. It was outpatient infusion center for transplant patients. And then travel nursing came about. So then I went into local travel nursing, back into med surge, like medical surgical type of nursing for 5 contracts.
So, of what you've done so far, what has been your favorite?
ER nursing. I absolutely love the ER.
Yeah.
Yes.
It's fast paced and
Hmm. Exactly. And the amount of stuff that you see, but then also trying to handle that can be difficult.
mhm,
And I definitely got burnout, but almost don't want to say burnout. Became a lot more calloused
mm,
to what I was seeing. And that's when I knew, okay, I need to leave the ER and go into something totally different.
right, right. So let's talk about the burnout for a minute. I know that nurses experience compassion fatigue, and that sounds a little bit like what you were going through when you decided to leave the ER. How
Mhm.
how do you work your way through that and come back to the point where it's like, yeah, I'm super excited to go to work?
I think nurses can feel stuck in a job when this is one of the best careers you can have, with how many job opportunities you can
Hmm.
do, whether that's bedside, remote nursing. I think with burnout, people don't realize they can leave a job, and it's okay to leave a job, because a lot of that stigma around nursing is, oh, if you're not a hospital nurse, you're not a real nurse. That's something that can be said in the nursing world, and that's totally false, because we need nurses of all different kinds to let this health system go,
Yeah.
like continue to go. um, so I think for nurses, just first understanding that it's okay to leave a job. Also, always realizing why you went into nursing and reminding yourself of that. It can be really hard in the beginning of your career when you first become a nurse, especially now. I mean, short staffing has always been a thing. It's been a thing for 10 years or so. I don't even know, probably longer than that. But now it's even more so, I believe. And I think also culturally, we're a lot more stressed than we used to be, like as a whole.
Hmm.
So, understanding how you deal with stress is important. And I think it does take newer nurses a little bit more time to figure that out. But I think as you grow in your career, you'll learn that more. Sorry, I know this is a very long answer to a short question. Um, so, just finding those things that decrease your stress, or reminding yourself, okay, do not bring my work home with me. I can't bring this home with me today. I can't continue to just think about this one thing that I could have done differently today, because you can't go back and change it. And you can't harp on yourself about something that you did in the moment where you thought that was the right thing to do in the moment. And I think that's where burnout can happen also, when you start just that rabbit trail of ideas of what could I have done different in this situation that this patient didn't die, or in a codes situation, something like that.
Right.
I think with me personally, with the ER, realizing there was like a breaking point for me. It was, I I am too calloused to work now. It was after I performed CPR and I felt no emotion at all. And I was like, okay, that's not me. That is that is not Catherine.
Yeah.
And I was like, okay, it's time to go. Because if I am feeling no emotion now and I'm this calloused, I am not going to be a benefit to my patients anymore. And I think realizing that too. And it's okay to leave and then come back. And that's totally
Right.
fine. Or take a break. take a vacation time, something.
Right.
But yeah, I think it can be very different for everybody. But definitely those things have helped me personally with burnout.
So tell me about your social media channel that you have. You do a lot on
Mhm.
YouTube. Where else are you on social media?
Yep. So I am primarily on YouTube and Instagram, and I also have a Facebook page. And that all started in 2019, and it was my husband's idea.
Really?
Yeah, yes. Yes, I was talking to him because people ask me a lot because I don't always share that I have a YouTube channel with like church families, stuff like that, because it's a little awkward sometimes to be like, "Oh yeah, I have a YouTube channel." But they're like, "How did you even get started in that?" And it was my husband's idea. And that was from when I first started nursing in 2016 to 2019. That first year of nursing, I didn't precept anyone. But after that, I started precepting new
Mm.
graduates. And I saw a huge lack of other nurses wanting to precept students or student nurses or new grads. And I was like, man, how can I reach more new grads? Because they're not getting the mentoring. Some of them are, some of them are not,
Mhm.
that they deserve, that they need to become a successful nurse. And my husband's like, why don't you start a YouTube channel? So that's what I did. And that was the whole reason behind starting my YouTube channel. And then that just branched out into Facebook and to Instagram to help bring more visibility to my YouTube channel.
So is that your primary goal, is to reach those people that might still be in school and those new grads, or has it expanded to something more than that?
Yeah, it's definitely expanded now. That was the primary goal in the beginning. A lot of it was education of nursing school education and yeah, just starting your career off right. Now I think I'm about half and half. About half my viewers are nursing students, half are already nurses. And I love talking about career changes because I've made so many career changes and how you can manage your career in a way that's not always taught. A lot of the time in nursing school, you're taught, okay, go right into the hospital. But there's so many other things you can do in nursing. And you don't have to be miserable in a hospital because the hospital setting is not for
Right.
everybody. And that has been really enjoyable to get into the career side of nursing, but also current events in nursing I like to talk about. That has been really neat because then I get to talk with my viewers in the comments section to hear their opinions about current situations going on. So I just really love to have that rapport. And also, I've talked to nurses all over the world, which has been really exciting because nursing here in America is totally different than nursing in Nigeria, I will
Right.
say. I did a medical missions trip to there and it was totally different. Totally kinds of different kinds of nursing. So, yeah, just networking has been a really, really fun part of how my channel has evolved and it's going to continue to evolve. I know it will. And it's fun. I'm not stuck to one particular topic. It's really neat to see, okay, what do my viewers want? Okay, what
Yeah,
will I give
let's
them?
let's do a video about that today.
Yeah, yes, exactly.
Looking ahead, how do you see the future of healthcare evolving?
Yeah, so as technology evolves, so does healthcare. And I've seen this in my last 7 years of nursing. I'm seeing more and more remote nursing jobs, which is really exciting because that's giving nurses different opportunities to work from home, which I love seeing. I love seeing that. So that's definitely opening up more jobs for nurses in different ways. I also could see healthcare becoming more personalized in the future. In some ways, it is like that now, but in other ways, it doesn't feel like that at all. As I said before, every person is so different and everyone's medical needs are so different. And also, like what I was saying, there seems to be a disconnect with education and prescription of care. So I think as technology evolves, that gives the consumers of healthcare an even better way to get educated, because we can use technology also to educate
Right.
in good ways. Google has been great for some things, not great for everything when researching symptoms and all of that, but it has been very helpful too. So I don't know what that's going to look like one day, what kind of education that's going to look like, or what providers are going to do, but I could see them saying, okay, you need to take these classes. And I think this probably already happens. You need to take these kinds of classes before we do this procedure on you, so you understand everything, the benefits and the pros and cons.
That would be
before
great.
you get this done.
Right.
Right? It would be wonderful.
Yeah. Like little mini classes on,
Yes.
this is what we're going to do to you.
Yes, it's like prenatal classes.
Right. Exactly.
Yes. Exactly. So I could see it going in that direction one day, which would be so beneficial to the person getting the prescription or surgery, anything like that.
That is such a great idea, because then that the person is getting all of the correct information. And if they didn't understand it, or if their family didn't understand, they could watch it again. That
Exactly.
would be very helpful. You should do that. You should start that
I know,
channel.
Right? Yes. Right. I'm like, if only I had enough knowledge in all of the things.
Oh yeah. That's incredible. That's a great idea. Somebody needs to do that. So for people that are listening and they're interested in pursuing a nursing career, a health care career, what kind of advice would you give them?
What I said earlier, I love to tell anyone in nursing, or generally in healthcare, is, why did you go into it? Always remember why you started this. And when you get burnout, or if you have compassion fatigue, or if you're like, I don't really know if I like this anymore, remember why you started it. And then remember, it's okay to not like something that you thought you were going to love. I went into the ER. I never thought I was going to be an ER nurse. I hated ER nursing when I was in nursing school. I was like, oh, you don't get to talk with your patients at all. That's not the kind of nurse I want to be. And then I ended up loving it. So just you have to dabble your feet in something if you find yourself stuck in a place where you're not enjoying it. But it is such a rewarding job. There is so much opportunity in healthcare. And a lot of healthcare, you are never going to be replaced by a machine. So you're always going to be needed.
Right.
So it's a great career to go into for that point too.
That hands-on bedside, nothing can replace that.
Exactly.
Well, it's been a pleasure talking to you today. I've really enjoyed it.
Yeah, thank you, Lori. I've enjoyed talking with you too. This has been really fun.